you need to have really consistent, easy to pass bowel movements. It is really important to do this to help manage the pressure and help prevent worsening of your uterine prolapse, doing it with exertion. This video is all about uterine prolapse. Have you been diagnosed with the uterine prolapse, or do you think you have a uterine prolapse? First, I'm Dr. Allison Felt. Let me tell you where uterine prolapse comes from. A uterine prolapse is where your cervix starts to descend down into the vaginal canal, and sometimes it can descend so far that it starts to come to the opening of the vagina or all the way out. And people feel like they have to push it back up in order for it to stay inside. A lot of times it gets worse by the end of the day or after an intense workout or after a really hard bowel movement. So let's talk about uterine prolapse and a few things that you can do to start to heal your uterine prolapse on your own. And then one non-negotiable that if you are at a dire need to try to fix your uterine prolapse or prevent it from getting worse, then you absolutely need the final tip that I will give to you at the end of this. Please like and subscribe to the video and share this with all your friends who've had babies, because the likelihood is they might at some point deal with uterine prolapse. Now, with that said, I want to let you know that uterine prolapse is often diagnosed incorrectly. Many times after people have babies, what they actually have is a bladder prolapse, or what we call a cystocele, where the bladder tends to come down into the vaginal canal. So it's the front wall of the vagina starts to collapse inward. Now, that is more common from what we see clinically than actual uterine prolapse. However, uterine prolapse can very much still exist. And what it feels like if you were to stick your finger in your own vagina, or if you feel this coming out, is it almost feels like a maraschino cherry is like a firm maraschino cherry is starting to descend down. And that's what you feel if you insert a finger or if you feel something coming out of your vaginal canal. That would be a uterine prolapse. And that is where the cervix is descending down the vaginal canal. Now, let me give you a little anatomy lesson. I'm going to show you with my organs here. So here is the bladder, a side view of the bladder. This is the uterus. The uterus is then connected down to the vaginal canal. The tip of the uterus is called the cervix, and that's what dilates when you're in labor and the baby comes through there, and then you push and baby comes out. The uterus actually does the contraction, so baby can come out and down through the vaginal canal. And also that's where you menstruate from. So if you're still menstruating, every month if you have ovulation, you'll then slough the lining of the uterus, of the walls of the uterus, and that will come down and come out through the vagina. And then you have your rectum on the backside. It goes from your sigmoid colon and turns into your rectum, and then the stool will come out the anus. They're lined up like this. If this was your vagina, so that middle one is the vagina. Now, if the bladder starts to come into that vaginal canal, then that is called a cystocele or a bladder prolapse. Or if the rectum starts to come into the vaginal canal, that's called a rectocele. Or where the cervix starts to drop down the vaginal canal, that's called a uterine prolapse. Now, if you have a uterine prolapse, this is something that can drive you absolute bonkers. And a couple of things that you need to make sure that you do to help improve your prolapse, or at least prevent it from getting worse, is number one, you need to have really consistent, easy to pass bowel movements. The more stool that collects inside the rectum, the more pressure it's going to push down on that cervix. So the more pressure it's going to have on that cervix to prolapse down into the actual vaginal canal. Now, if the poop is moving through every day and it's soft but well formed and there's not a lot of pressure happening, then we can evacuate the stool and there's not a buildup of pressure on the uterus itself. So the number one thing to really focus on is, how can I get my bowel movements super good so that I'm evacuating stool every single day and I'm not having to push or strain to get the poop out. That might be challenging, and you should absolutely work with a pelvic expert physical therapist if that is a challenge for you, because they can help with your stool mobility and stool consistency to make sure that your peristalsis is happening, that you can get poop out every single day. Now, I want to side note this, that if you are on Ozempic, that can really slow, or any of those glucose drugs that are helping with weight loss or helping with diabetes, that can really slow down peristalsis, and you can get a buildup of stool inside the actual rectum, and that can increase the pressure down onto the cervix itself. So you just want to be very cognizant that you're doing everything in your power to keep your stools moving, because the gastric effects of a lot of the new weight loss drugs that are trending and helping with the obesity epidemic have side effects. And if you are dealing with uterine prolapse, it's something that you need to consider. Your gastric emptying will be decreased, and therefore you are going to have decreased or increased pressure on your pelvic organs themselves, because you have a decreased peristalsis. So you're not moving poop through as fast and as easily. Now, there might be less of it because you're not eating as much, but the reality is it needs to move, or pressure is going to build up. So get your bowels moving and get them evacuating as frequently as you can without having diarrhea, because diarrhea can increase the pressure as well. So that is the number one thing you can do. Number two is called blow as you go. We want to decrease the abdominal pressure that is in our bellies. What happens when you inhale? When you inhale here, that increases the pressure down onto the uterus. When you exhale, the air leaves, that decreases the pressure on the uterus, decreasing the pressure on that cervix that's coming down through the vagina. Now, if we inhale, and then we do something strenuous like lift a chair on the inhale, that's gonna put a ton of pressure down onto that cervix. What I want you to get used to doing is, when you move your body, you focus on doing it with exertion. If you're gonna move a chair, you're gonna exhale first, blowing the air off of your uterus. So then lift the chair, and then you can breathe. Now, what we call this is blow as you go, or blow before you go, decreasing the air that's creating the pressure down on the cervix. It is really important to do this to help manage the pressure and help prevent worsening of your uterine prolapse. One of my other favorite things to do is just simply move up my uterus and take the pressure off of the vaginal canal and take the pressure off the pelvic organs. So how I do this is I just take my hands and I scoop right above my pubic bone, and I scoop up towards my head, lifting up my bladder, lifting up my uterus, just giving a nice relaxing lift and taking the pressure off. Now you can let it go, and you can hold this for a minute or two, and you're just gently moving the organs up. I'm not putting a lot of pressure on, so if this was 100%, I may be doing about 20%. And it's a very gentle glide of the uterus and of the bladder, lifting up towards the head. So my fingers are pointed downwards and right down towards my clitoris, but then I'm lifting and elevating up. And I'm not at the level of my clitoris. I'm above the pubic bone, above the mons pubis area, and then just gently lifting up, doing a glide of the bladder and of the uterus itself. This can be a very nice and relieving technique. And again, you don't even have to do this laying down. If you were out and about running errands or at a fair and on your feet for long periods of time, you can absolutely do this move while you are standing. In fact, they even make belts for people with uterine prolapses to help decrease the pressure. And the whole idea is that you take the pressure off by lifting up the organs. And this is something that you could do, incognito when you're out in public. Just have your hands here and simply lift up towards your head, and you'll help decrease that intra-abdominal pressure and help just realign the organs and take some of that pressure off, lifting up the cervix out of the vaginal canal. This part is the most important part of this video. If you want your uterine prolapse to improve at all, or if you want to make sure it doesn't get worse, you need to work with a pelvic expert that is going to evaluate and treat all of the muscles of the pelvic floor, because oftentimes when the muscles of the pelvic floor are dehydrated or they're not able to contract and relax and coordinate very well, they dry up. They become beef jerky. They lose their elasticity and their juiciness. And then we sometimes get vaginal dryness because of that. Oftentimes, people that have been doing Kegels for years or are trained to do Kegels to help the uterine prolapse, it's actually ineffective, and sometimes it makes it worse because you're just squeezing around the cervix that's already descended past the level of the pelvic floor. And so Kegels are not always the answer. This is why we have intensive programs set up for people to come join us at Body Motion Physical Therapy. We have locations in Edmonds and Poulsbo, Washington, and they come for intensives. So a week of therapy where we reset their pelvis, reset their pelvic floor so their cervix can start to work its way up to go back home. And we do this naturally. We do this without surgery, without bladder mesh, without any of those tools. And simply, we teach you how to maintain and keep your uterus where you want it to be. There is so much that you can do. You are not subject to having it fall out of your body. And if that is happening for you, I want you to get this help because there are improvements that can be made. There's so much that can happen that's good for your body. And when you start to heal the real root cause of this and you don't cover it up with surgery, then your core also works better for you. So your entire body starts to work better for you. Your joints feel better. Your bowel movements are better. Everything works better. That is the secret to truly healing your uterine prolapse. Work with a pelvic expert. If you don't have one that is going to holistically look at the entirety of the inside and outside of the pelvis, then travel here to Body Motion Physical Therapy. I no longer give recommendations to other people in other states because it's just too challenging to find someone and trust someone who is good enough. That's why we offer this intensive program. We specially train all of our providers here. Thank you so much for joining me. I hope you enjoyed this video, and I hope that you start your journey to healing your pelvic organ prolapse naturally. And with our help, we would love to join you on this journey so you can live a fit, healthy, and fulfilling life and do everything that you want to do without being bogged down by your cervix coming out of your body. I'm Dr. Allison Felt. Please like and subscribe to this video and share it with any of your friends who suffer with this issue too. Take care.